Hi everyone. Thank you for joining us on this online sharing today. So before we start, I will just give a brief introduction of how today's flow will be. So as usual, first we will have a special topic sharing. So for this week's special topic, we will be talking on rheumatoid arthritis. So Dr. Fida will share to us on the information for this week's special topic. And then if you have any question, you can just note down, and then we will have a Q&A session for you to ask your question. So after that will be our testimonial and how to use our machine. This will be shared by Madam Yi herself. So now we will just start with the special topic sharing for today. I would like to invite Dr. Fida to share on today's special topic, which is rheumatoid arthritis.
Okay, hi. Everyone can hear me, yeah?
Yeah, I can hear.
All right. So, Assalamualaikum and a very good afternoon to everyone. So, my name is Dr. Norhida binti Ismail. So, for topic this week, I will talk about rheumatoid arthritis. So, why I choose this topic by this week? Because of recently, I just received a few messages from my other colleague and also my older friends who are asking me about arthritis and rheumatoid arthritis. So, basically, we can say that rheumatoid arthritis is not a very serious issue, but it could be a serious issue due to some of them cannot move well and their joints suddenly very swelling and very in pain. So that's why by this week, I will choose topic rheumatoid arthritis. So in the first screen, as you can see right now, so this article, I just want to show you, actually rheumatoid arthritis we can say like 0.5% to 1% of the adult populations is affect about 5 in 1,000 people. So I get this article in the Stars News in 2007. So I know this is quite late before, but the recent study also in 2020, if I'm not mistaken, they are dealing with how are the treatments and how to prevention of rheumatoid arthritis. So this one I just want to show you how the statistic of rheumatoid arthritis available in Malaysia. So this is just I want to share you, and you should know what kind of rheumatoid arthritis it is and how to prevent and what are the risk factor of it. Okay, so the next slide will be. Okay, so before we are moving more further, I will explain first what is rheumatoid arthritis. So basically, rheumatoid arthritis is autoimmune disease. So it's when you know immune is that's mean your white blood cell. Okay, if let's say you follow me since first 2 months ago, so I'm talking a lot about immune disease. So basically, immune is a white blood cell. So just need to remember that. Okay, so it's an autoimmune disease and it can affect our whole body. Okay, why? Because the inflammation, the swelling, pain in the joint, and effect will be affected your other body's organ. So this is a very serious issue. Why? Because when it already affect your body organs, so that means you cannot move, and suddenly your kidney have a problem or your lungs. So that's why rheumatoid arthritis, maybe you can see it's a very simple, but actually it can cause a trauma to the patients. Okay. So now I just briefly explain how it happened, because some of them will ask me, some of my patients will asking me how it happened, how to counter it, all that. So actually the causes is unknown. Okay, the causes is unknown. It may become suddenly attack. Okay, so I just explain. Now I can explain to you how it happened. At first, it will occur when your immune system, that means your white blood cell, mistakenly the healthy cell as the foreign substance. So remember, what is the function of white blood cell? Okay, so function of white blood cell to kill any foreign substance or toxic substance. So that means when your immune system is not okay, this is happen when they are mistakenly mistake the healthy cell as the foreign substance. So when this is happen, that will cause the inflammation occur. So the inflammation part occur in the usually in tissue, or organ. So when this is happened, for example, like a joint, so maybe your ankles, your shoulder. So this rheumatoid arthritis will be affected these two joint, which is your your shoulder and your ankle. So these two you need to be very, very careful and to be take care. So this is basically how it happens. So now I will explain you what are the factors, what are the risk factors. So usually we can say that rheumatoid arthritis will be affected among female 60 years ago. 60 years and above. Why? Because you can see that female have a lot of hormone as compared to the men. So that's why the risk factor we can highlight 60 years female. Okay, and the next one, genetic. So usually inherited genetic from maybe your grandparents have it, maybe your grandchild or your children also can have the rheumatoid arthritis. The next one, obesity. So of course, when you are obese, your hormone will be affected. It's not balanced, and also you have a weight gain, and will affect especially your knee. All right, and the last one, smoking, of course, because smoking, as we know, the tobacco, the nicotine, all that will be affected your body itself. So these are risk factors who are very, we can say, major risk factors who are affected among most of the patients. So that's why I said you need to know what are the risk factors so that you can prevent to have this kind of disease. Okay. The next one, sign and symptom. So now I just share you 6 sign and symptoms that we can say is generally, and most of the patients have it. Actually, we have a lot, maybe more than 10, but I just present you 6 points because of this is a major sign and symptom of it. So the first one, when you have rheumatoid arthritis, for sure you have a swelling. So the swelling part usually we can see in the joint. So the one that I said, shoulder, ankle, and knee. So usually you can see the swelling, you become bulky. And when this is happen, it will be stiffness. So the stiffness is because you cannot move. Yeah, because of when your knee is swelling and everything. So that's why you cannot move because of the stiffness. And when you have a stiffness, and then for sure you have a pain. Okay, so why pain? Because you cannot move. Okay, due to swelling and due to stiffness, then you will starting to feel the pain and the warmness, especially in the joint part. The next one, when this is happened, it will affect your mobility and loss function. So loss function and mobility, that means you cannot walk. You cannot walk, you cannot move freely. Why? Because of the swelling, stiffness, and the pain. And some of the cases, we can see that some of the patients will having a weight loss. Why? They have will lose appetite because they cannot move and they can feel the pain. So that's why they have a weight loss. And after that, your joint will deformity, so you cannot move. So this is we can say 6 signs and symptoms that majorly affected most of the patient of rheumatoid arthritis. Okay, so if they say you're having this kind of symptom, please make sure you refer your doctors or your any physiology also can help to reduce this kind of symptom. Okay, and this is the treatment. So I just simply bracket rheumatologist. So if let's say you're having rheumatoid arthritis, so at least actually we have the specialist on it. We call as rheumatol, which is, so usually you will have these 4 flow. So the first one is physiology. So as you all know, I'm pretty sure most of you will know that physiology we do once a week or twice a week to reduce the swelling and also to make your body move. Okay, when physiology happen, of course you will have the medications. So the medication usually will be prescribed from the doctors. 3 type of non-steroid medication. So this is non-steroid, not a steroid. It's just a non-steroid. So we have 3: Motril, Aleve, and Advil. So these 3 medication usually will be prescribed most of the rheumatoid arthritis patients. And when the physiology also cannot, we can say it's not improved for you, it's not suitable for you, the medication also is not suitable for you, then the last result will be surgery. So surgery usually will have arthroscopic surgery and carpal tunnel surgery. So arthroscopic surgery, usually we just repair your bones and your muscle, usually at knees, shoulder, and also the ankle. So also sometimes it's at the back. So these are arthroscopic surgery. And carpal tunnel usually in the hand here. So carpal tunnel usually we focus here. So if let's say it will affect usually among the person who are working in the office and also the gamers, because they are sitting in the laptop and for a long time, like 2 to 3 more than 3 hours in a day, and every single day. So that's why they will having a carpal tunnel. We call it carpal tunnel syndrome. So basically the surgery is carpal tunnel surgery. All right, so after we do the physiology and also the medication and surgery, the last resort. So of course, some of you will be searching another method. So we call as alternative treatment. So alternative treatment, what we have here is RET. Okay, so reducing electron therapy. So most of the patients who are having a rheumatoid arthritis will be searching another alternative treatment. So here we will focus more on RET. So what is reducing electron therapy? So basically it's a biochemical reaction that gives electrons, which is negative ion, towards your body. It's not harmful, it's non-invasive. So it just gives you negative ion towards your body. It's a natural way. Okay, so the main effect of reducing electron therapy is we have 5 major effects, which is regulation your autonomic system function. That means your breathing, your sleeping pattern, all that. So that one is an autonomic system function. Second, proper your hormone function. That means the hormone imbalance or not balanced. So it will regulate your hormone function very well. And third, this is the highlight one, increase your immune system. Okay, remember the white blood cell. So it will increase the amount of white blood cell and activate your white blood cells. The last one, the second last is homeostasis. So improve homeostasis is make it your cell body become very healthy. And the last one, improve your blood circulations. So these are 5 main effects of reducing electrotherapy that help your body. So these 5 major effects, if let's say you have a rheumatoid arthritis or other disease as well, for sure you become more, we can say more healthier than before. Okay, I'm not saying that if let's say you use this therapy, it will be helping you in terms of for sure, like in a blink of eye, you already okay. No, it takes time. All right. So this is how it looks like. For example, you can see on your left side, abnormal red blood cell. So as you can see, abnormal red blood cell, you can see that red blood cell is like clumping and attached very closely to each other. Supposed to be our normal red blood cell on your right side. So you can see your red blood cell is like moving away from each other so that your blood circulation is moving freely. So when this is happened, your blood cells, your cells body become healthy, your pH value are also okay. If let's say you are not okay, you can be, that's when your body, it become like on the left side, the abnormal. So you can see the blood cell is like very clumping. So blood is not well. That's why you get, you having a very serious issue, become disease or other cells. Okay, so this is what we want, the normal red blood cell. So you can see the negative charge. So that negative charge is reducing electron therapy give to your body. Okay. So this is what the major effect that can help most of the rheumatoid arthritis patients. So reducing electron therapy can help 2 things: reduce the inflammation and increase your immune system. So reduce inflammation. Remember that's what I said, when you have rheumatoid arthritis, of course you become a swelling, you have swelling and stiffness. So reducing electron therapy can help you in terms of reduce the inflammation. How to check, how to know? Of course, you need to do the blood test. So the blood test usually we can see in the CRP value, so that you know how inflammation, how your inflammation level inside your body, is it okay or in the normal value or in the high value. So when this is, we can say reduce and plus increase your immune system. That's mean your white blood cell. So when increase immune system, for sure, white blood cell also become active. So just now I said arthritis is because immune system attack the good cell, correct? So here, when we increase the immune system, that means we want to correct all these things back. So we want to correct all the system. So that's why reducing electron therapy can help 2 things: reduce inflammations, and increase the immune system. So when these two can help most of the rheumatoid arthritis patient, of course, they can move well, their mobility become very good. So this is what reducing electron therapy can help most of the rheumatoid arthritis patient. So if let's say you have any, we can say any questions or any want to know more about reducing electron therapy, of course, and most welcome, you can email us, and this is our hotline number. Then our product is 100% imported from Japan. Okay, so basically that's all, because today we got a very short topic, because rheumatoid arthritis is, we know already, it's an autoimmune disease, so that's why it's a very short topic. So hopefully you understand what I'm saying just now, and thank you so much for listening. If let's say you have any questions, you can ask me now. I will help you to I will answering your questions as much as I can. Okay, so any question for that? Okay, guys, any questions? So for any question, most you guys can ask any question regarding rheumatoid arthritis.
If
If
no
no, I will
question,
go to,
yeah,
yeah,
if no
this
question, I
question.
would like to thank you, Dr. Fida, for very interesting sharing on today's topic.
All
So,
right.
yeah, so I'll be taking over for the next session. For my part, I will just share a little bit more on rheumatoid arthritis, but it's based on the research done by Dr. Noboru Horiguchi, which is the founder for this reducing electron treatment. Okay. So to let you all have more understanding about this disease and how reducing electron treatment can actually help. Okay. So before I share about the rheumatoid arthritis, actually it's very important to know this self-defense diagnosis. So you may ask, what is a self-defense diagnosis? It's basically a diagnosis to determine whether you have the ability to maintain your health and to prevent diseases. So let's say if you have a strong self-defense, it means that you actually have the ability to fight diseases and you will not be able to get sick easily. But if your self-defense is quite low, that means you have a higher risk of developing diseases. This is based on the research done by Japan. So self-defense actually consists of these following three elements, as you can see from the picture. This triangle, each corner of this triangle actually represents a different characteristic. So the first one you can see is the level of cellular metabolism. Cellular metabolism is actually very important for us because most of the diseases that we can see is developed due to the problem in cellular metabolism. So for a normal cell, we actually absorb the nutrients into our cells and then convert them into energy. So this process is known as cellular metabolism. But for those people that easier to get diseases, their cellular metabolism is not that active or is not that good. Means that their cells can absorb the nutrients inside, but their cells don't have the ability or the resources to convert all of that nutrients to become energy. Why? Because cellular metabolism actually requires oxygen and reducing electron. So for oxygen, we don't need to worry because every day we breathe in oxygen. So our body will be full of oxygen at always lah. But for reducing electron, because not everybody has enough or sufficient reducing electron in your body. So once your body is lack of this reducing electron, your cell actually don't have the resource, which is the reducing electron, to help them to carry out this metabolism. So your cellular metabolism will be affected, and which is why you have a higher risk of developing diseases. Because once your cellular metabolism become poor, it will lead to a lot of problems like oxidation, acidification, all those things will lead to the diseases. So the first one is cellular metabolism, which is very important. The second one is the strength of immunity. So like what Dr. Fida mentioned just now, immunity is very important because it is the defense system, our body's defense system to help us to fight diseases, viruses, bacteria. So if we have a very strong immunity, our body will have the ability to fight diseases. But if our immune cells are not active, we don't have a high or strong immunity, then we will be able to get diseases easily. The last one is the level of inflammation sedation. So you may wonder what will cause inflammation. It's actually caused by a lot of factors, including like radiation, overwork, tiredness, stress, or positive ions. All these things will lead to inflammation. Let's say your body has very high inflammation. That means that your body is have a higher risk in developing diseases because you have a high inflammation. If you can ensure that your inflammation in the body is reduced to as low as possible, then you will have the ability to fight diseases. So in order to achieve a strong self-defense, you need to ensure that these three elements are always at the optimal level, which is a good cellular metabolism, strong immunity, and low inflammation. So with these three elements at their optimal level, you will have the ability to fight diseases, which we say you have a very strong self-defense. Let's say if one of these elements or more is affected, then you will affect your own self-defense as well, which is why you will develop diseases. Okay. So like Dr. Fida mentioned just now, rheumatoid arthritis or RA is an autoimmune and inflammatory disease, which means that your immune system attacks your own healthy cells by mistake, causing inflammation in the affected parts of the body. So as you can see here, rheumatoid arthritis focus on two important parts, which is the immune and inflammation, which is also included in the self-defense diagnosis that I've mentioned just now. So you can see in rheumatoid arthritis patient, their self-defense are affected. Because why? Their immunity and their inflammation got problem already. That's why they can develop this rheumatoid arthritis. So in order to tackle rheumatoid arthritis, to help this patient, we need to tackle these two main points, which is the immunity and the inflammation problem. So I will share how reducing electron actually helps. So for immunity, reducing electron actually strengthens our own body immunity. So this is a research and a clinical study done by our Japan hospital. So for this clinical trial, it actually takes a lot of time and a lot of participants, because for one treatment or a device to be recognized as a medical device, to have the ability to treat or to prevent diseases, it actually needs to undergo a lot of clinical trials and a lot of these studies in order to have the result to prove that it actually has the effect. So Japan actually did these immunity clinical studies on HIV patients, and this is the result that they have obtained. So you can see here they have 4 different groups. The top part, both of these group is actually undergo this reducing electron treatment. So for the measurement, they actually measure the amount of CD4 plus T lymphocyte. So this CD4 plus T lymphocyte is one of our main immune cells in our body to help us to fight diseases. So if we have a lot of these lymphocytes, or also very strong and active these T lymphocytes, it means that we have a strong immunity, so our body will be able to fight diseases. So you can see here, the both of the groups that undergo reducing electron treatment, actually before the treatment, you can see their T lymphocyte is quite low. But after 12 weeks, which is 3 months, you can see their CD4 plus T lymphocyte increases, okay, for both of the groups. As for the group down here below, they do not undergo this reducing electron treatment. Means that they don't do this treatment lah. So you can see their results before and after 12 weeks. Mostly is no changes, like minimal changes. You can see it's just almost a straight line. So they did these clinical studies, and it actually does show that reducing electron treatment actually did strengthen our immunity, because you can see the amount of these T lymphocytes actually increases already. Means that our body has active immune cells and a strong immunity to help us to fight diseases. So for a rheumatoid arthritis patient, we can help in a sense of their immune system to help them to strengthen. Okay. So for the second major part that we have to tackle is the inflammation. So what causes inflammation? Like I've mentioned just now, you can see here also stated: stress, overwork, intense exercise, radiation, UV rays, electromagnetic waves, all those, and also like the small things that we usually don't really look into it, like lack of sleep, excess carbohydrates, fat, or even injury, surgery, infection, medication, radiotherapy. All those will actually lead to inflammation. So you can see here we have chronic and acute. Acute means that it happens on the spot. Like for injury, surgery, like injury, you bang yourself or you cut, you have wound. That one is injury. So you can see your wound will have inflamed. The wound site will become like red, maybe swollen. All those is acute inflammation, which happens very fast, like on the spot. But for chronic inflammation, it happens along the way, like it accumulates in your body as a long-term inflammation. So which is why you can see the causes is all those little habits of in our life that we usually don't look into, like stress, overwork, UV rays, radiation from your electronic devices, lack of sleep, all those lah. Okay. So this long-term inflammation, you can see like if you accumulate all these causes, it will cause disorder in autonomic nerve balance, and then it will cause disorder in immune balance as well. So once two of these main system in our body has encountered problems or imbalance, it will lead to inflammation. And then you can see here, it also stated disorder in blood circulation and lack of oxygen, which means that once your blood circulation is not that good, then you can have inflammation. Okay, so what reducing electron targets in this case is blood circulation and immune balance. So for immunity, like I mentioned just now already, it really strengthens our immunity. Okay, so for this part, I will touch more on the blood circulation part. So this one is the same picture as what have been shared by Dr. Fida just now, but I will just repeat one more time so that you can remember how reducing electron actually helps. So for the left side, you can see this one is without reducing electron in our body. So for a normal red blood cell, actually we have all these electrons surrounded outside our red blood cells on their membrane. So because they have a lot of these electrons, so minus and minus, the negative charge, will repel each other, which is why our red blood cell in a healthy person mostly is separated. You can see the circle clearly, okay? But for people who is lack of reducing electron, plus they have all these causes like I mentioned just now, the stress, the radiation, all these things actually will cause our body to have this positive charge, which is positive ions. So once these positive ions takes over the negative charge of this red blood cell, you can see we have plus and minus, we have positive and negative charge. Both of these charges will attract each other, which is why it will cause our red blood cell to be clumped together. So once our red blood cells are clumped together, you know our red blood cell function is to help us to carry oxygen. So once they are clumped together, it's just like you are inside a very packed full of people in the lift in a shopping mall, let's say. So if it's very packed, it's a lot of people, you stand inside, like both of your hands cannot move, you cannot carry a lot of things. The same thing happened to our red blood cell. Once they are clumped, their ability to help us to deliver oxygen to the whole body will be reduced. So the amount of oxygen that they can carry will be reduced as well, which is why once your blood circulation is affected, your oxygen circulation will be affected as well. Okay, so how reducing electron helps in this problem is because reducing electron gives us this negative charge. So once this negative charge is induced into our body, okay, it will help us to eliminate all these positive charge by neutralizing them. So they will eliminate all this positive charge. So what will be left is the negative charge that is originally in our body, which is coating our red blood cell. So which is why they will repel each other again. It will help us to separate our red blood cell again. So once our red blood cells are separated, it's like you are in an empty leaf already. You can carry a lot of things, a lot of bags. So same to our red blood cell, they can carry a sufficient amount of oxygen which is required by our body to deliver to all parts of our body. So in a sense that reducing electron can help us to target this blood circulation and lack of oxygen problem. Because once our blood circulation is improved, our oxygen will be delivered to all parts of our body. So we won't be lack of oxygen in our body. So we can prevent inflammation or reduces inflammation. So as a conclusion, what I've shared, the important point is reducing electron helps in strengthen immunity and reduces inflammation, which is important for rheumatoid arthritis because these are the two main causes that causes this disease. So with a good self-defense, we will not be able to get sick easily as well. So reducing electron is not only targeting in one disease, one specific diseases like rheumatoid arthritis. By controlling the immunity, the inflammation, and ensure that you have a good self-defense, we can actually help you to achieve a healthy body and a healthy life, and to help you to prevent with all kinds of disease as well, like cardiovascular, diabetes. Like when your body is healthy, all these disease will not be easily developed in your body lah. So reducing electron is actually good for you to achieve a healthy body to prevent diseases. So this is from my part. If you have any question, you can ask.